Carter, and this is my assessment video for the lungs and the anterior posterior thorax. Today my patient again is my dad, and if this was a real setting, I would have already got the subjective data, asked him all the questions, explain what I'm about to do, the procedure, answer any of his questions, and have him change into a gown today. A fishing shirt is our gown. So come back in, let's begin. So I'm going to start with the inspection part of the posterior thorax. So what I'm going to be looking at is I'm going to be checking for the muscles and the bones and the curvature of the spine, any observations for lesions or masses or anything. I'm also observing for accessory muscles when he breathes, if he's sitting in a tripod position. So I'm looking, I'm inspecting. You had any pain or tenderness lately?
None.
Okay, I'm looking. Everything seems to be normal. The skin has no lesions or masses or rashes. Patient seems relaxed. Breathing is normal and no abnormal spinal curvature. So now I'm going to palpate for tenderness, sensation, temperature, pain, crepitus and fremitus. So I'm gonna start with checking the temperature with the back of my hand. I'm checking bilaterally. So I'm feeling here. Okay. Temperature seems to be normal, and I'm going to now palpate. I'm going on both sides, and there's going to be 5 on each side, and I'm going to kind of go in this kind of a pattern. Any tenderness?
No.
Okay. This is the third one. Into the back. All right. Now I'm going to check for the fremitus. So what I'm going to do, Dad, is I'm going to, every time I touch you on one of those spots, I'm going to ask you to repeat the phrase 99.
Okay.
All right, so you ready?
Ready?
Okay, go.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so what I found was the temperature is equal bilaterally and the fremitus is symmetrical. So now I'm going to assess for chest expansion. So I'm going to put my hands like this, middle of his back, take a deep breath in and let it out. One more time. Good. Okay, so movement is symmetrical bilaterally. Now I'm going to move on to percussion. I'm going to percuss for tone. I'm listening for resonance. So same thing, I'm just going to tap you on the back. You don't have to take a deep breath or anything. I'm just assessing for tone. Ready? And again, there's going to be 7 positions that I'm going to percuss. Listening either for dullness, fullness, but you want to get resonance. All right, now I'm going to assess the lateral sides. Okay, just comparing the sides. Okay, good. Now I'm going to auscultate. So if I had an alcohol pad, I would be cleaning my pad, making sure that my diaphragm is nice and warm for the patient. I don't want it to be too cold. I'm listening for breath sounds. So what I'm doing is I'm going to ask you to take a deep breath in and let it out, and I'm just going to listen. So 5 different spots. Again, the physician is going to go kind of like this on his back. you need to take a break? Okay. All right, last two. Good. Okay, I'm gonna give you a little bit of break. Okay. Now we would switch the lateral sides, and I'm going to compare on either side. Good. All right. Good. Perfect. Okay. So our findings are the posterior lung sounds are clear to auscultation. So now I would switch to the anterior thorax portion. Dad, is there any way we can take off the shirt and switch it
Sure.
to like normal? Just have it open. Thank you. So again, everything that I did posteriorly, I'm going to do anteriorly. I'm going to start with the inspection. So I would be looking again at the skin, the bones, the observing for accessory muscles when he's breathing, respiratory pattern, any sternal retractions, if he has any, and again his positioning. So I'm just looking here, I'm looking, seeing if there's any abnormal not abnormal curvature, any barreling of the chest. No. Okay. Very good. So my findings are the patient seems to be relaxed, breathing is normal, there's no retractions observed, the sternum is midline, the skin tone and color are even, consistent, and there are no visible lesions, rashes, or masses. So now I'm going to switch to the palpation part. I'm going to palpate for tenderness, sensations, masses, look at the muscle development, and again for the crepitus and the fremitus. So let's see, I'm in the way here. So I'm just palpating and use the pads of my fingers and kind of make a circular type motion here. And the pattern for it is going to be kind of like this, and it's going to be 4 on each side. So I'm going to do a comparison. Do I have any pain or tenderness? Any shortness of breath lately? Okay. The inpatient seems to be relaxed, breathing normally. Good. Okay, so one last thing, temperature. And check with the back of my hand. Check for skin moisture. See if he's diaphoretic. Good. So findings are patient temp is equal bilaterally. I'm going to check for the fremitus again, so I'm going to have him repeat the phrase 99 at those spots that I just checked. Okay. All right. Say 99. Okay, ready? Go.
99. 99. 99. 99. 99. 99. 99.
One last one.
99.
Good. Okay, so again, anteriorly the fremitus is symmetrical. The skin is smooth. I didn't see any lesions and no unusual vibrations. So now I will assess for chest expansion. I'm going to do that W again. Place it right here. Take a deep breath in. Let it out. Good. One more time. Okay. Chest expansion is equal and bilateral. So I'm going to percuss. I'm going to do 5 spots this time. I'm going to start right by the clavicles and kind of go in and go down. I'm checking for that resonance. Checking for dullness, fullness. Trying to feel for the vibrations. Okay, last but not least, I will auscultate for breath sounds. So, trying to see if I hear any adventitious breath sounds. So, again, I'm going to have you take a deep breath in. Tell me if you need to stop if you're getting shortness of breath. Okay, and it's going to be that same position, 5 on each side. Okay. Good. Good. Okay. Last 2. Good. Okay. So findings were lungs are clear to auscultation and no adventitious lung sounds were heard, no crackles, no wheezing, no bronchi, no stridor, nothing like that. So that concludes my assessment video. If you have any questions, let me know. Thank you. Thanks, Dad.
Go Saints.